So our presenter today is Jill Patton. Jill is a licensed clinical social worker and certified case manager for the professional athlete care team at Tulane University. She assists in implementing recommendations based on the Tulane Brain and Body and Milestone Wellness Assessment programs for former players referred to by the trust to the professional athlete care team. Jill has focused her career on her passion for working in healthcare as part of a multidisciplinary team, including acute rehabilitation, managed care, acute care, and outpatient care management settings. Jill comes to us with 20 plus years of clinical experience working with diverse populations, performing assessments, and providing complex case management, including follow-up, client advocacy, and patient and caregiver education. She is a member of the Case Management Society of America, the Alliance of Social Workers in Sports, and the ASWIS Professional Sports Committee. So Jill, I will let you take it away.
Thank you. So as Tess said, I've been a social worker for 20 plus years, and working with athletes is new to me as of a year and a half or so ago when I joined the Pact Clinic. So this is definitely a new field. It's been exciting to learn about professional athletes' experiences, their transition out of the league, and all of the different mental health issues that can come out of that. So it's definitely been an eye-opening experience for somebody not previously in athletics. It's also my first experience working with athletic trainers, and it's never been a dull moment with our fabulous four at the Pact Clinic. I don't know how they juggle so well while putting our guys at ease and still managing to provide comic relief to us all. So it's been great working with the four of them. So one of the reasons I decided to do this is that I have been working with the Alliance of Social Workers in Sports, went to their conference in October for continuing education just so that I could learn more about athletes and mental health. And it's definitely becoming a important and more recognized area of study and research. And so that's pretty exciting to have social workers and mental health included in athletics now. They now have the first official NFL social worker full-time with the Panthers. So that was in 2018. So it's a pretty exciting time. Everything used to focus more on performance and not as much as mental health. So I'm speaking today about mental health promotion and athletes and the importance of our role in reducing the stigma for athletes. So our goal is to make athletes feel just as comfortable seeking to help improve their mental health as they would if they had a physical injury. So we will start the slides. So disclosure statement, I have nothing to disclose, no actual or potential conflict of interest. I do have a personal disclosure to make. I must warn you that I have a lazy 105-pound coworker that may at any point try to chime in with a ferocious bark, as he did a few minutes ago. So I apologize up front for that. Objectives today is to differentiate among situations on when to encourage an athlete to seek support and when you need to seek support for the athlete. Identify ways to familiarize yourself with your workplace mental health crisis protocol, recognizing the signs and symptoms of mental health concerns, and discuss how to decrease the stigma of seeking help. So the first thing is, what is mental health? According to the World Health Organization, mental health is defined as a state of well-being in which the person can tackle the normal difficulties of life, is aware of his or her own abilities, can work productively, and is able to contribute to his or her community. So some of the common stressors that we have when talking about mental health, whether it be an athlete or just one of us regular humans, relationship or family problems, an experience causing intense shame or humiliation, isolation. So obviously today during the pandemic with the COVID-19, there's a lot of that going on. Homesickness for college athletes and NFL athletes moving away. difficulty transitioning to life after athletics or other transitions, abuse or violence, financial or legal issues, physical illness or injury, and new or increasing responsibilities or demands. So mental health promotion involves actions that improve psychological well-being. This may involve creating an environment that supports mental health. And this is from the World Health Organization. Promote sensitivity to the mental health needs facing athletes. Provide athletes a safe place to advocate for their own needs. Be mindful of the individual and cultural differences of each athlete. And look at the individual not only as a competitor, but as a student, friend, family member, community leader, and any other lenses an athlete identifies. So this was taken from a Twitter account during the NCAA Diversity and Inclusion Week, just showing athletes saying they're more than athletes. In this particular case, soccer player, daughter, Christian, loyal, fearless, sports management major, leader, sister, passionate, good friend, and a volunteer. And so a lot of times we have looked at athletes and just their athletic performance and their role in that, and not all of the other things that they identify as. So the NCAA Sports Science Institute is a leader in providing health and safety resources to college athletes, coaches, athletic administrators, and campus partners. The NCAA provides resources to help better understand how to address mental health concerns of college athletes. The goal of these resources is to encourage a culture in which reaching out for mental health care is normal and expected. So we look at the mental health continuum. Mental health historically has been overlooked as part of the overall health of an athlete and optimal functioning. Mental health exists on a continuum, with resilience and thriving on one end of the spectrum, and mental health disorders that disrupt an athlete's functioning and performance on the other. And obviously at any time on that continuum, it's a fluid. So athletes can appear to be doing well and thriving and then have an injury, which could move them down towards the mental health disorder. Athletes are human too, and often have more pressure than their peers. Some of those pressures can be high visibility, whether that be in their communities, on social media, or in the news. Being a part of a culture of toughness, which concerns about team status and playing time. Injury, which can involve grief, denial, anger, and resentment. And time demands, so how to juggle their academics, their practice, their games, their travel, and being able to sleep and take care of themselves. So the NCAA best practices for mental health include the next 4 things. Number 1 is the clinical licensure of practitioners providing mental health care. Number 2, procedures for identification and referral of student athletes to qualified practitioners. Number 3, pre-participation mental health screening. And number 4, health promoting environments that support mental well-being and resilience. So best practice number 1, clinical licensure of practitioners providing mental health care. The athletic trainer is often the first point of contact in managing health concerns in student athletes. The team physicians often coordinate the overall medical and mental health care. Coordinating and managing mental health care should be distinguished from more formal evaluation and treatment. So a qualified licensed practitioner may include a licensed clinical social worker, licensed counselors, psychologists, and psychiatrists. This practitioner should be easily accessible, including the establishment of a self-referral process. So in the past, it used to be that if there were some concerns, they might make a referral straight to the mental health professional, but we also want to encourage athletes and persons in general being able to ask for help on their own and not through a referral source. And sometimes they might not want to seek help through the athletic department and actually want to do the referral themselves with a little bit less stigma, perhaps. Best practice number 2 is procedures for identification and referral of student athletes to qualified professionals. So the recommendation is that there's written procedures for the entire team to be able to follow for the management of emergency mental health situations and routine mental health referrals. The NCAA best practices includes for life-threatening mental health emergencies to either call 911 or call the National Suicide Lifeline at 1-800-273-8255. There's also other protocols that we will each have at different institutions and who's accessible to us, but that's always a standard that can be followed, whether it be an athlete or a coworker. It is recommended that for best practice number 3 is pre-participation mental health screening. It's recommended that mental health screening questionnaires be considered part of the pre-participation exam. Screening tools are not validated as standalone assessments for mental health disorders and should be incorporated into the entire evaluation. So some of the screening tools recommended by NCAA best practices are listed here, and it's to cover various things that are potential stressing areas for athletes. The general index is a suggestion for the mental health related survey that the athletic trainers use, and I will show that at a next slide. ADHD is common, alcohol use, anxiety, sleep apnea, cannabis use, depression, disordered eating, and insomnia. And these again are recommended by NCAA, but each institution can use their own scales depending on what people want to use. Also at the Pact Clinic, we use different scales. It just depends on, as long as it's a common string used for all athletes within the same institution, to make sure that we are using comparison correctly. So screening tools, it's important to remember that athletes will tend to underreport for a variety of reasons, and screening tools are just that, a screen, not necessarily a diagnostic tool. They can also be utilized at various times to monitor progress or changes. So if you're doing them prior to seasons and coming into the department, and then something changes, whether or not somebody has an injury, there's a death in the family, athletes are returning to their programs following the COVID-19 isolation and getting back into the swing of things, you can use those screening tools again to see if there's been any changes. Also, if somebody's been diagnosed with depression and initially had a very high risk score on their depression scale, once they are undergoing treatment, you can give that again to see whether or not there's been an improvement. Scales, like I said, will vary from program to program, and the importance is consistency within your own program and with each athlete. So the National Athletic Trainers Association suggested general index survey. This is the one that they're saying that almost everybody should use within the athletic training profession. In there is, I often have trouble sleeping. I wish I had more energy most days of the week. I think about things over and over. I feel anxious and nervous much of the time. I often feel sad or depressed. I struggle with being confident. I don't feel hopeful about the future. I have a hard time managing my emotions. I have feelings of hurting myself or others. So the scoring responses for this one are simple yes, no answers. And any response of yes should lead to a follow-up discussion with the athlete and a member of the healthcare providing team or the point person to decide whether or not further evaluation needs to be done and if a referral should be made to a mental health professional. And that's just an example of one of the surveys, and this one is a pretty simple, quick, easy one to do. Best practice number 4 is health promoting environments that support mental health, well-being, and resilience. The way we communicate about mental health can demonstrate our commitment to inclusion and wellness and our support of all student athletes, including those with a history of mental health concerns or those experiencing mental health concerns for the first time. Education information can include self-care, stress management, signs and symptoms of mental health disorders, and the importance of sleep and well-being and performance. Athletic trainers and mental health. Athletic trainers play a unique inside role in the life of the athlete. They're usually the primary point person, spending day in, day out with the athletic trainer, and the athletic trainer probably knows them better than most others within the team. ATs can identify red flags as well as provide the opportunity to be an advocate for the welfare of the athlete, just as if they had a physical injury. Athletic trainers can educate athletes about the importance of mental health and mental health resources. So some of the red flags we look for with mental health issues or illness is excessive worry or fear, feeling excessively sad or low, poor concentration, extreme mood swings, agitation, irritability, social withdrawal, changes in sleeping habits, or feeling tired and having low energy. Some additional red flags include changes in appetite and/or weight, increased substance use, inability to carry out daily activities, negative self-talk, obsessive thoughts, and lack of motivation. This is not intended to be an exhaustive list of symptoms, but a list of more common symptoms that we see. And it's important to realize that no one sign or symptom is indicative of a mental health issue. We want to look at the severity and duration of symptoms, and also the higher number of symptoms that you're seeing could be a higher risk for the individual. So we want to encourage the athlete to seek help and/or help the athlete make an initial appointment if we see red flags. So the reason we want to do that is mental health issues, if not treated, can affect athletic performance and limit training and competition until managed or treated. An athlete who is experiencing mental health issues is injured just as if he or she has a physical injury. Treatments do vary by diagnosis and by person. There's no one-size-fits-all treatment. Treatment options can include medication, therapy, social support, and education. We must work collaboratively in the helping process to restore, maintain, and enhance an athlete's ability to be successful in all areas of life. So the collaboration piece, we want to make sure that we're identifying the resources that are available and integrating strong professional working relationships within our own organization and within the community to ensure that we stay well informed and respond quickly and effectively. So the more we know our resources, for instance, in the Pact Clinic, being able to call trust program managers or Player Care Foundation or Lifeline or Stigma EAP, we know exactly what resources that our retired NFL players have, and we have good relationships with them to be able to call them and discuss them further and make those referrals. Working collaboratively maximizes the supports available to our athletes. Sorry, having some technical difficulties. So emergent mental health referral is one thing that people always ask is, when is it considered emergent? So according to the National Athletic Trainers Association, these are the four kind of giant red flags. Demonstrates or voices an imminent threat to themselves or others. Reports feeling out of control or unable to make sound decisions. They're incoherent or confused or expressing delusional thoughts. These are also things that if a person was brought to the emergency room, that a physician is going to evaluate to determine whether or not a person needs inpatient treatment. These are kind of the most important factors here on whether or not they would proceed with, you know, voluntary treatment, inpatient treatment, or needing to write an order for protective custody for further evaluation. So these are definitely the things that we want to look for and that we want to get help for somebody quickly. So the NCAA recommendations regarding individuals at risk for suicide. When dealing with a student athlete who's expressed, indicated an intent or plan or attempted suicide, do not try to determine the lethality or seriousness of the thought, gesture, or attempt. Such thoughts, behaviors, or threats are serious and potentially dangerous, so we should always treat them as such. Do not assume the person is engaging in suicidal thoughts or actions for attention. And make an immediate referral, as we discussed. Follow your institution's mental health emergency protocol. Suicide prevention, be prepared, know the plan. So when we talk about our institution's emergency protocol, that's the kind of thing we want to know about. So Friday at 4 p.m., telephone call from a possible suicidal student athlete or retired athlete is not the best time to generate a plan. Each institution should have a suicide prevention or mental health crisis plan in place. The steps should be clearly described and available to all staff so that each staff knows what their role is in the plan. Keep the names and phone numbers of referral sources available, including daytime sources and after-hour options. It's best to know your protocol and resources before you actually need to use them. Make sure a suicidal student athlete is not left alone. The student athlete should have someone with him or her until a psychiatric evaluation is completed. We also have cases that we're dealing with athletes on the telephone, especially in the Pact Clinic. We have retired athletes that we're following up with, or possibly that the athletic trainers are talking to during a phone intake. And this might mean staying on the telephone with an athlete while we can get resources to them for further evaluation. So the reasons we want to respond quickly and seriously is our quick response lets a student athlete know that you take his or her health, difficulties, and life seriously. It's better to err on the side of responding too quickly rather than too late. Depressed individuals engage in negative thinking. They often feel unworthy or worthless, and the lack of response on our part may be interpreted as confirmation for the student athlete that he or she is not worth the time or the trouble. So when responding to a student athlete, if they approach you for help, some of the things that we want to make sure that we do is stop what we're doing, look at the person, and listen to them. Listening is the most important part of communication. We want to listen non-judgmentally, so we want to avoid any negative reactions. Being genuine and present will help, even if you don't know what to say. Assess for risk, including self-harm or suicidal thoughts. Signs can be feeling helpless or hopeless, talking about not wanting to be alive anymore, or visual signs of self-harm. We want to reassure the person that we want to help, and we want to encourage seeking help in the same way we would for a physical injury. So if somebody is on the field with a broken leg and we are going to encourage them to get that treated, we want to do the same thing when we're dealing with mental health issues, and explaining and helping them understand that aspect. And then, of course, we want to make a referral. So reducing stigma, how do we do that? Most importantly, we talk about it. Many people don't want to talk about mental health. They don't want to deal with mental health. You know, they still have the mindset of, they think I'm crazy, my mom was crazy. So, and we don't talk about those kinds of things. So we just want to get more comfortable talking about mental health. And just as, you know, we would if you're talking with a student athlete and telling them about, oh, you know, when I was an athlete and I had that problem with my ankle all the time. Same thing of, you know, I used to deal with anxiety, or I had some issues with depression, or, you know, maybe I used alcohol too much to help me cope. Those kinds of things is just, you know, letting people know that it's okay to talk about those things. You want to normalize the conversation around mental health. So when somebody does bring something up, we don't change the subject. We don't get somebody else to talk with them. We just want it to become a normal part of our conversation within athletics. And posters and handouts in the athletic training rooms, just like at our clinic, you know, we have different posters talking about heart disease, nutrition and wellness, being able to start putting up things that have to do with mental health in the training rooms, posters, handouts. We use the NFL Lifeline at the clinic to make sure that people have that access. So maybe they don't want to ask us for help while they're there, but at least they have a phone number they can call if they need it. Oh, there goes that lazy coworker. And most importantly, that it's okay to not be okay. So that's another part of reducing that stigma. Again, we can all play a role in ending the stigma. We need to use respectful language to talk about mental health conditions. We need to challenge misconceptions when we see or hear them. We need to see the person, not the condition. We need to offer support if we think someone is having trouble, and we need to avoid labels. And these are some great labels to avoid. Psycho, nuts, maniac, mental, insane. Again, you know, these are funny ones, but it's true. And a lot of people still consider people as nuts or crazy, or, you know, they think I'm crazy. So we need to really reduce that use. See the person, not the condition. So people have disorders, they do not become a disorder. We don't refer to people with health conditions as their health condition. So we want to do the same thing with mental health. Avoid referring to a person as an anorexic. Instead, use person with anorexia, and that can go with any mental health disorder. And as we know, professional athletes are starting to help destigmatize mental health disorders, coming out and talking about their experiences, talking about their suicidal ideation, talking about bipolar, eating disorders, anxiety, all of these kinds of things that they have struggled with, and being able to come out and explain that, and the help that they've gotten has really come a long way. And it's great for student athletes to know, but also a lot of our retired NFL players. You know, when you put other people knowing again that other people are going through these things and that it's normal and you're not crazy, really helps to destigmatize mental health issues. So some examples of mental health resources. So I broke it down into, for Tulane Athletics, mental health professional at your educational institution. So most of you know that the Tulane Athletics mental health specialist is Lauren Miller. And that would be your primary contact. Also, Tulane CAPS for counseling services has same-day consultations and after-hours crisis support via phone or text. So again, any educational institution that you're working at, you want to know who those people are, who are your contacts, whether it be within the high school, whether it be within a college. You just really want to make sure that you know who those contact people are and what's available after hours. For the Pact Clinic patients and retired NFL players, we have 2 social workers, including myself and Jennifer, that are available for resources for mental health, whether it be giving referrals to their Stigma EAP plan, whether it be giving out the Lifeline, whether it be connecting them with their trust program manager for more intense treatment. We also have our PACT psychologist, Dr. Miller. We also have our psychiatry team that meets with them and is available, but as far as the regular contact with the guys, we're there and we're available to them. We also, since we're not a 24-hour clinic and we don't have an on-call team, we leave on our voicemails the NFL Lifeline, since they have access to that 24/7, and it's similar to the regular Lifeline available for people other than retired NFL guys or their families. And so they can call that and get instant access to help. And then, of course, for anybody, you have the National Suicide Prevention Lifeline. And obviously, you can contact 911 if you're just really not sure what to do or you're panicking. And know that they'll get the help that they need. So at the Pact Clinic, we're a little bit different than working with the Tulane athletics and how that all works, because we're obviously dealing with retired NFL players. So we have a lot of touch points that somebody, one of our guys, could tell us that they're having some mental health issues, or that we might notice some red flags that, we know that we need to get them some help. And our program, we have different steps into getting them into our program. And so the phone intake is done by our athletic trainers, and they go over a multitude of medical questions. And then there's also a mental health section asking, if they have any concerns, whether or not they've had treatment in the past, substance abuse, things like that. So at some point during a phone intake, an athletic trainer can get a red flag, or a guy might come out and tell them that they have concerns, they're feeling really depressed, they're feeling out of control, and finding out whether or not they have resources or not. So when we're in the clinic and something like that happens, they usually get transferred over either to Dr. Miller, who's now on staff with us full time, or to Jennifer or I as one of the social workers, to make sure that they have resources. And the main thing that we assess for during a phone before we've even met the patient is whether or not they do have resources, whether or not they have a support system. And we want to make sure that they have the benefits set, which makes it easy for us because they all have access to the Cigna EAP benefit, and they all have access to the NFL Lifeline. So just making sure that they have those and know how to use them is really important. And then prior to being scheduled to come in, they do some pre-visit health questionnaires, just as they would kind of an intake into college athletics. And so one of those is a depression scale, and there's a question on there for people that are not familiar with the PHQ-9 on whether or not they're having thoughts of hurting themselves, or that they would be better off dead. So if people answer yes to that question, no matter how much, Dr. Stewart receives what we call a bubble in our ECW medical system. And then he would refer that over to Dr. Miller to give the patient a call, find out again what's going on, what are their resources, do a little bit more of a crisis assessment to see whether or not they need immediate assistance and who their support systems are. Again, making sure that they have access to the NFL Lifeline and that they have the Cigna EAP information. And then when they come in to see us for the 3-day assessment, they have access to multiple mental health professionals and might honestly get sick of answering questions from all of us. But again, at any point, they could say something to one of the athletic trainers that they didn't say during the social work assessment, the psychology assessment, the psychiatry assessment, during neuropsych testing. So at any point, any of us could again deal with a red flag. We are fortunate enough to have many mental health professionals within our clinic, and being able to refer to Dr. Stewart as well for coordination. And since we are downtown at a hospital, we also have access to an emergency room, just in case, same as if we were to have a medical emergency. So we are fortunate in our clinic and where we are to be able to have the resources that we do. And lastly, Jennifer, myself, or Indra could be following up with a patient on the telephone, and we do that at regular intervals, or they might call us out of the blue and have questions about mental health resources or start talking about issues that they might have. So again, we have multiple chances to be able to provide these resources to the guys and to be available to them for that. And again, always to make sure that we have that NFL Lifeline on our voicemail. Another example of the mental health protocol is the Player Care Foundation screenings that are done around the country, again, for retired NFL players. And that's done with our medical team on site with the guys. And part of that has, again, dealing with including mental health as part of the overall assessment. They have recently started including the mental health questionnaires and screening tools at those screenings, including a depression scale, an anxiety scale, and a substance use scale. And then they meet with either the Player Care Foundation social worker or one of the Pact social workers. We score those tools, take a look at them, and if we see that anybody is at moderate or severe risk on any of those scales, we walk them out to the Stigma representatives who are there on site to be able to provide them with resources before they leave on how to get help for counseling at home and wherever they're from. And then if a retired player, again with the PHQ-9, endorses suicidal ideation, we walk the player over to the NFL Lifeline crisis counselor who's on site for this particular reason and for an evaluation and recommendations. And then we also let our medical director, Dr. Stewart, who's on site, gets notified as well. And fortunately, nobody has had to be brought to the emergency room. There's immediate follow-up either by the Player Care Foundation social worker, or if it's one of our guys, either Jennifer or myself would follow up with the guy following the screening just to make sure that they have been connected with their mental health resources and if there's anything else they need. So it's just a few examples of touch points and examples of protocols to follow and make sure that you have in place. So athletic trainers, know your limits, and that's for anybody. We need to know our limits. We all have them. To avoid the student athlete's difficulties weighing too heavily on you, you need to know your limits. You need to be aware of what is reasonable to expect from yourself. Your responsibility is to recognize and refer. And the most important thing for an athletic trainer to know in a crisis is what is the protocol for my organization and who and what are my mental health resources. And that concludes my discussion today. So I'm open to questions and answers.
All right. Thank you, Jill. So I will go ahead and read off.
Do I need to stop sharing now?
You can if you want, or you can just keep the Q&A up. I think that's perfect. I will read off the questions that came in order. So the first one says, how can pre-participation mental health screenings be done? Is this something that can be done with the physical pre-participation screening? So anything you want to give to that question?
I personally don't work in the college setting, but I did a lot of research with the NCAA, and I don't know if one of our Tulane athletic trainers wants to chime in, but I know I spoke with Lauren Miller prior to doing this as well, and she said that the scales that are used are the ones in the NCAA best practices, and so typically those should be being included in all of the I want to say medical, but you know, your enrollment packet, so to speak, to make sure that your physical assessment and mental health assessment are all included together so they can look at the entire picture.
Great. Okay. So the next one, since the best practices came out several years ago, the move was to make sure mental health was housed within the healthcare team. How do you feel or believe that non-healthcare providers should be involved with the referral and management process? Should it remain with healthcare professionals due to liability and overall experience?
Whoa, okay.
Yeah.
So, I mean, I guess in my experience working, whether it be healthcare and now in athletics, there's always going to be non-healthcare people, but it doesn't mean that they're not involved. And that goes back to the protocol and knowing everybody having a role in it, because somebody could disclose something to a housekeeper at the gym. So I just think it's really important for people, again, to know who the resources are how to get them to them, and then what is the protocol for your workplace? How do you get them referred? It's not saying that a non-healthcare professional needs to deal with a mental health crisis in the fact that they're the ones doing direct intervention with the person, but they need to be able to call for help for somebody.
Okay. All right. So say we have an athlete who has some sort of diagnosed mental health disorder. His or her only outlet or way of feeling better is by playing. Do you allow them to play, or is this feeding and or making things worse?
Well, I mean, that would be up to the mental health professional that is actually the practitioner that is treating them to determine what's best for them, because not all behaviors, it can be positive and negative on coping mechanisms. And so that's really going to be up to the mental health practitioner and diving into what's going on with them and what's best on whether or not they should continue playing, or if they need to work on symptom management and other coping mechanisms.
All right. All right. So next one, what would be a few suggestions on how to weed out these red flags from normal teenage angst? Working with high school athletes, I hear the majority of red flags on a pretty consistent basis.
Well, and I think that's the point, is the red flags. So, and yes, there's a lot of teenage angst, but they're also a very vulnerable population. So again, it's looking at red flags, and you want to see, is this something new that's going on with somebody? Are things becoming more intense, more frequent with them? Is it starting to interfere with their functioning? And also, how many of these red flags are you seeing? And regardless, like I said, even with, the urgent referral, we always say that we want to be overly cautious rather than under cautious, is to go ahead and refer them to a school counselor and let them do an evaluation to say, you know what, they're dealing with everything okay. I'm not concerned at this time, or, maybe they need some additional coping mechanisms. So again, we don't want to assume that it's anybody with angst or that it's for show. We always just want to side on being overcautious.
All right. All right. Do you have any recommendations for places to find posters or handouts for a high school athletic training room?
I can definitely send some your way if you want to include, there's various sites. The national NAMI is a really good one, National Alliance Mental Institution. But I can send you some different sites if you want to include an email.
Okay. Perfect. Okay. Just moving through. Any suggestions for when a minor wants to seek help, but a parent is the major problem, and so they don't want their parent to know or need to approve it since they're not 18 yet?
So the good thing when it comes to school counselors is they can be seen. So whether it be in high school, or if it's a 17-year-old in college, being able to be seen by the school counselor doesn't have to have approval by the parent to do so. Now, when it comes to billing and all of those different kinds of things, then obviously insurance and parents would need to get involved. But I think the most important thing is that those things are confidential, but they also have to realize that, if there's ever any concern of that person being of harm to themselves or others, that's going to be disclosed. And that goes back to just having a safe environment for athletes to be able to talk to somebody.
Okay. What, if any, extra guidelines do you feel we will need for resocialization, return to campus athletics, and the new normal?
That's a lot.
We knew it was coming.
And I'll be honest, I think that's, for everybody, but, like I said, college athletics is not my specialty in any shape or form. So I definitely don't want to be the one to say this is what needs to be done. And that's the great thing about having an entire team, just like the NCAA recommends. You know, it includes various mental health professionals, medical professionals, athletic trainers, everybody that's working with them on how to help them deal with it. And I think a lot of it just has to do, the most important thing is the stigma and the making sure that people have a safe environment. And again, just that it's okay for people to talk about it and deal with it, and they're not the only ones that feel that way. And I think there's going to be a lot of availability of mental health resources. There is, you know, just within Tulane for employees, for healthcare workers, for students. And I think the most important thing, again, that I just keep reiterating is know what those mental health resources are to make sure that they know how to access help.
All right. Okay. Can you give us your thoughts on integrated collaboration between healthcare professionals and the case management of athletes with substantial mental health needs?
Say that one more time.
Can you provide us your thoughts on integrated collaboration between healthcare professionals and the case management of athletes with substantial mental health needs?
So again, I'm speaking from my experience and not within the college or high school, but within our clinic, a lot of what the social workers, Jennifer and I do is case management, and we are extremely integrated with the healthcare team as far as that goes, but also with their trust program managers. And again, it all has to do with, you know, how much they want to have shared, but I think it's also having those good relationships established with those resources and those case managers. So I'm not sure exactly that question on who if you're talking about something like the trust program manager versus us, in that case, we have excellent rapport with them. And of course, they're the ones sending our athletes to us, but we also have to have permission from the athlete to be able to share that information with them. So as long as we have that, we work extremely collaboratively with them in order to make sure, because they're the ones that can make referrals for us for more inpatient mental health resources and substance abuse treatment.
Okay. What recommendations do you have for athletic trainers and or schools that have limited access to mental health professionals due to funding issues or understaffing of those professionals?
Community resources. A lot of the lazy dog is speaking up. A lot of that is having to do with community resources. So if we don't have some, and you know, we do have some guys that live in smaller towns and trying to find those resources. So it doesn't necessarily always have to be within the school itself, but to really be able to make some connections within the community to be able to find mental health resources that you can refer out to.
Okay.
And most have, you know, if income is an issue and finding resources, you know, a lot of the mental health clinics, you know, there's free clinics throughout in each parish that are available.
Okay. Looks like maybe one or two more. When working with an athlete who has a mental health condition, how do you go about helping the athlete when the sport itself or coach seems to be a major stressor or cause?
So again, I'm going to defer a little bit because all of the guys I'm working with are retired athletes. But part of getting help in mental health treatment is being able to deal with our stressors, whether it be finances, your coach, or relationship. And I think the most important thing is evaluating support systems and making sure that you do have somebody within the system that can support you. and advocate for you. And I think the athletic trainers is, that's a good role to be in, to be able to advocate for the player.
Okay. All right. Once you have made the referral of a high school athlete, and I guess maybe this could apply for collegiate also, but how often should you check in with the athlete since you have made the referral? Should you just let the better trained professionals handle it or continue to follow up?
I think that's also part of the protocol for the athletic department on kind of what their standard is. But if it's somebody that's having some issues and they're not necessarily, it's not an urgent referral, you can let the player know that you're available if they want to talk about anything, how things are going. But it's really up to them in that relationship. But again, within the athletic department, it could be something different. I mean, within our clinic, if we make referrals for somebody or we make a recommendation as part of their exit for them to seek mental health counseling, Jennifer and I are following up with that on a regular basis for them. But again, there's kind of some of those constraints within the athletic department that is it affecting their play and it doesn't make sense for them and things like that. So I think that really depends on what the protocol is within each department. But I think it's important to follow up with them and let them know that you're still available for them.
There you go. All right. Well, we're kind of wrapping up here. And let's see, I don't really know if we will have time for another question. Let me scroll through. We have a lot coming in. And see, let me see. Okay. This might be a big one, but can you speak more on the need to have specific avenues to resources or staff opportunities to break down barriers for minority and underrepresented groups to access mental health resources on college campuses?
Can you say the first part again?
Can you speak more on the need to have specific avenues or resources or staff opportunities to break down barriers for minority and underrepresented groups to access mental health resources on college campuses?
Sure. Cultural sensitivity and cultural training is part of, for any mental health practitioner, that's an ongoing process. And so I think with the mental health professional that is on the team, whether it be within the athletic training team, whether it be at the Pact Clinic, whether it be in high school, I think, again, it's just letting people know what mental health resources are available. And if they have specific, one of the things that we go through at the Pact Clinic is when we're offering to assist with finding mental health professionals back home for guys, is asking them if they have any preferences. So I think it's important to know that not everybody's going to feel comfortable with one particular therapist, whether that be because they're male or female, whether it be their race. Maybe it's just not a good fit for them, and letting them know that if they have a preference, then we'll help find somebody of that, whether it be ethnicity, like I said, gender, a spiritual based counselor, things like that. And just, there's multiple different kinds of resources to find. And for some people that don't believe in counseling, going to their pastor might be an option, things like that. So.
Okay. Great. So thank you, Jill, for being with us today and presenting during this webinar.